Now, Daktari, let us look at how to prevent, of course, now how to prevent urinary tract infection. Before now, us looking at the recurrent UTI, of course, we have those women that every now and then they are experiencing UTIs. Let us just look at how to prevent UTI.
Okay. Okay. So the prevention part is the most important part. So when you're doing your prevention, the first thing you're supposed to do is hydration. Why? Hydration means that you take plenty of water, so you'll be passing more urine.
Okay.
So if there's any bacteria in the structures that I mentioned earlier on, so once you drink a lot of water, you'll be passing a lot of urine. So if there's any bacteria lodged, it will be passed out with the urine. So hydration is very important.
Okay.
So you are supposed to take 2 liters in a day or 3, depending on how you can handle it.
Okay.
Yes.
All right. And that is for both genders.
For both genders.
Men, women, and even children.
Yes.
All right. Okay. And I think that is the most easiest way of course, preventing UTIs. Any other way of prevention?
Yes, there's another way. So the second part of it is hygiene, especially for ladies. I had already mentioned that we are prone to have frequent UTIs because of our anatomy.
Yeah.
So hygiene comes in hand. So for the toilet part, we're supposed to wipe from front to back, and not from back to front. Yes. Yeah.
All right.
Okay. Same on that hygiene. I would like to add on, when you're taking your bath, so those people that have, they don't have showers.
Okay.
Yeah. So they have that basin or a bucket.
Okay.
So the first part to wash should always be your private part. And it should not be the last part.
Okay.
Because once you wash your body and now the water is no longer clean, then you're taking all this dirt to your private part. Yes.
Okay.
Yeah.
All right. Okay. And of course, now the issue comes in for when using probably a public toilet.
Yes.
Yeah.
Okay, now it's still under hygiene. For the public toilets, what I've always advised my patients and what I always do, so what you do once you get into a public toilet, you don't know who was before you.
Yeah.
Yeah. So first of all, you flush your toilet.
Okay.
Then if you have tissue paper, you must have tissue paper. So you can wipe with it, or wipes or whatever you have. Then you put a piece of toilet paper inside the open part, the down part, the one with water you can put, so to prevent splashing.
Okay.
Yes.
All right. And now my question for them, that is when you say we should wipe ourselves, especially for the ladies, from front back, how about, let me just say you've gone for a short call. How about tapping instead of, does that work as well, or you're still putting in the bacteria?
So now, as long as you're doing it the correct way, even, for our Muslim sisters, they always use water. Yes. So it's always good to start with the front part before you go to the even if you part, it's fine, as long as you're using the correct way.
Okay, so the problem is now doing it from back front.
Yes.
Okay.
Yeah.
All right, and that's a very great thing to learn. And now on issues of a recurrent UTI, first of all, let us look at why would a UTI be recurrent for some people and not for others.
Okay, so when we say recurrent UTIs, we mean that you've had 2 bacteria infection in a period of 6 months.
Okay.
2. Or you can have 3 or more in a period of 1 year.
Okay.
Yeah, so once you find yourself, maybe you're treated last month, then 3 months down the line you have UTI. So now that one translates to recurrent UTI. Yes.
Okay.
Yeah.
All right. And so why will this be happening?
Okay. So we have so many causes why we have recurrent UTIs.
Okay.
Number 1 cause is over-the-counter drugs. Yes. so many of us, we like shortcuts, right? So somebody will have those signs. Let me just start with itch. You will have that itch. So you go to a chemist near you. No one has certified that you have UTI. You also don't know why you have the itch. It could be something else.
Yeah.
But now, once you present yourself at the chemist and you say, I have this itch, okay, they are going to prescribe for you what? Antibiotics. So you've done yourself self-medication. Yeah, you've diagnosed yourself. So no one told you it is UTI. Yes. So now you find 2-3 days later, the itch is still there. You still go back to another chemist. Yeah. And then with that, your UTI becomes recurrent.
Okay.
Yeah.
All right. Any other cause of the recurrency?
Yeah. Then we have number 2, we have misuse of antibiotics. So us, generally, we have something called normal flora. We always have bacteria that is protecting us, especially women. It is there for to help us with our pH and acidity.
Okay.
So if you misuse your antibiotics, you kill the normal flora that is supposed to protect you. That's why now you have that itch.
Okay.
Okay. So now, how do you misuse your antibiotics? So now you prescribe these drugs for 5 days. And I can tell you for free, by day 2 or day 3, you're feeling better. That's why some of us will stop. They will not
They won't
they will not
finish
finish
the
the dose. Yeah. So now, next time, that drug will not help you. What are you going to do? You're having something called resistance. Yeah. So you create a resistance. Now, these antibiotics will be useless. Yes.
Okay.
For
All
you.
right. And still on the issue of self-medication, let me say, for example, someone came to you, you diagnosed them with UTI, of course, from the signs that this person was feeling. And the next time, when this person undergoes these signs and symptoms, they no longer come to you because they are like, these are the same signs I experienced, so let me go to the chemist and just probably take the antibiotics that I was given there.
Yes.
Then will that still be another cause?
Yeah, because some people, once you prescribe for them the medication, you'll never see them again. They will never come for review. Let us test to see if the medication is working. They will never show up. So what they do, next time they have that itch, that same box, they will use it and go to the chemist and purchase the same drugs.
Yeah.
Yeah. But now that is wrong because you have to test and then do culture to know why you are having recurrent UTIs. Maybe the bacteria you are having cannot work with this drug.
Medication.
Yes, that's why you find a lot of people, they are having issues because of what they are doing. Yes.
All right. And you've just brought in the diagnosis bit of it. Now, for recurrent UTIs, do you still diagnose the same? Or is it different now from this UTI that probably just comes once?
Okay, now for recurrent, that's how you say it is the number of times this person has this bacteria.
Okay.
But now this time around, you do something called urine culture.
Okay.
For recurrent UTIs, we do urine culture to find out which bacteria exactly. Because earlier on I'd said 3. You could find more. Yeah. Yes.
All right. And for the UTI, of course, we have those that will be, or just the recurrent one. We have those people that will be like, UTI is normal. This is normal. This is something that most women go through. Should we treat UTI as a normal infection?
Yeah, UTI is a normal infection, but now you should take precaution and you should treat it seriously like any other disease. Why? Because it has complications once you have it. Yes. That's why we cannot say this disease is for ladies alone. No, we are supposed to treat both partners.
Okay.
Yeah.
Okay, especially for the sexually transmitted bit as you.
Yes.
All right. And now you've brought in that of treating both partners. Let me say will that still be another cause of a recurrent UTI, that maybe me as a woman, I'll come to you and say, I'm experiencing these signs, but I don't bring my partner along?
Yes. Okay, so with the stigma associated with the UTI, because it's most associated, most in women, so you find out that this lady will come to the hospital, they have these signs and symptoms. You've ruled out everything, you found out that it's not STI, but it's UTI. So now that bit of bringing their partner, some of them shy away from that.
Okay.
This is what they always tell you, what if he will think I'm the one that brought the disease to him. He will think I'm sleeping around, you know. Although it's not, UTI is not STI, but it is a risk factor for STI and a risk factor for sexually for recurrent UTIs. So once you have the lady has presented to you with UTI, you must also treat the partner. Yes.
Okay, so there shouldn't be that notion of it's only women that are affected or infected with a UTI. I think that is a very important bit that you brought out. Thank you for that. Now let us look at when treating now the recurrent UTIs, or how for the prevention bit and treatment bit, is it still the same with the let me just call them normal UTIs, or is it different?
Yeah, it will be for recurrent. It's the treatment part of it is the same, but now you must use culture. Culture isolates which organism. Okay, so if it's E. coli, then it will tell you it is highly sensitive to which drug. Now you use that particular drug.
Okay.
But for UTI, you can just prescribe any antibiotics. But for this one, if it is recurrent, you must do culture to find out which organism is causing this. Yes. Yeah.
Okay. And just as you put it, I think the most important bit is with the recurrent UTI, or this other UTI, of course, is the treatment bit, and most importantly, even the prevention bit of it.
Yes.
So let me just bring us to now, even as we wind up, the prevention bit of now recurrent UTIs, even as you tell us maybe what do we, or do women or men do wrong for them to have these recurrent UTIs?
Okay. So for the treatment of, for the prevention of recurrent UTIs, it's more the same as the UTIs. But now, this one for recurrent, hydration bit of it, probiotics. You can also use something called cranberry juice or cranberry pills. Yeah. Then for the prevention part of it, you also treat the partner. Yes. And then we also avoid, some condoms, they have that spermicide. So we avoid that. Yes.
All right.
Yeah.
Okay. And just as we wind up, maybe anything that you feel like you'll want to tell our audience as far as a urinary tract infection, or anything that you feel like I haven't maybe touched on?
Okay. So for these UTIs, just as I said, they are common to both genders, but mostly in women. So if your partner comes to you and tells you that I've been diagnosed with UTI, there's no, it's not good to shame them. Yeah. So you encourage them to take the medication, because if they don't, they'll have resistance, and then it will lead to complications.
Okay.
And then, yeah, it will be a menace to treat this thing. Yeah. And you spend a lot of money. It's not the way people think. They think it's just a simple
Something
thing
that you can treat.
Yeah. And then we should always avoid this over-the-counter drugs and self-medication. Yes.
All right. Thank you so much for that. There's just one bit that I want you to maybe just a little bit emphasize on, and that's on the issues to do with how exactly should your urine color look like for you to, I think it's a way of prevention as well, because when I see that my urine is probably too yellow or too brown or dark brown, I'll be like, I need to either hydrate myself, or of course just seek medical attention.
Okay.
Yes.
Okay. So for this bit of your urine color, I think this is where we should emphasize. Okay, so now we start again.
So you can just lift it up.
If you're hydrating properly, if you're drinking a lot of water, most of the time your urine should be like this, should be colorless, should not have color.
Okay.
Yes. So hydration is very important in the prevention of UTI. Yes. You drink a lot of water.
All right.
Second, if you find that your urine is cloudy, foamy, and then there's color change. It is either yellow, amber, or with blood. So now, this one should be at the back of your mind that I have something that is not right. Because if I'm drinking a lot of water, I should not have this. Yeah, because most of the people, they don't drink a lot of water, especially during cold seasons. Yes. Yeah. So for this urine, it will also have a smell, foul smelling urine. Yes. So this one, you should go and get tested for UTI or anything else. Yeah.
All right.
So for this one, if your urine is yellowish or dark brown means that this person is severely dehydrated. They don't drink water.
Okay.
Yes. So now, chances of us getting bacteria, that UTI, they are high. Then to change it from this color to this, we're supposed to hydrate, drink a lot of water. And then we can also use probiotics. We have probiotics yogurt or cranberry juice or cranberry pills.
Okay.
Yeah, for this one.
All right.
Yes.
Okay, great. Dr. Thank you so much for that. Thank you for enlightening us and just informing us on matters to do with a urinary tract infection. Of course, as you put it, many people will be like, that is just a normal thing, or that is just a small thing. But as you say, it's very important to seek medical attention. Yes. Now, let me just give you an opportunity to wind up, even as you probably share where you come from and if someone maybe wants to reach you.
Okay, so we're located, Poland Hospital is located at Embassy House, first floor, Harambee Avenue. So once you get there, or you can also call us on this number, 0795-339-145. We are going to help you. Yes.
All right. Thank you so much. Once again, thank you for informing us, and thank you for just sparing your time to inform us on a urinary tract infection. All right. That's Dr. Nora Casio from Poland Hospital, or a general practitioner at Poland Hospital, just informing us on matters to do with a urinary tract infection. And of course, that's where we end our conversation this morning at. But just to let you know that, of course, we have looked at the causes of urinary tract infection. What are some of the signs and symptoms of urinary tract infection? How exactly to prevent urinary tract infection, not only using medications, but the most important bit is there are things that you can do at home to prevent UTIs and, of course, also recurrent urinary tract infection. So thank you so much for tuning in. That's all we had for you as far as this Healthy Monday is concerned. My name is Aida Munzati, and the guest in studio is Dr. Nora Casio.